This video is on transport mechanisms, in particular transcytosis and ABC transporters. So classification of transport mechanism include the following: passive transport, which includes simple diffusion, facilitated diffusion, aquaporins, ion channels, ionophores. So this has been already presented and released as video. You can watch this. So the second one is the active transport, which includes uniports, import, antiport, exocytosis, endocytosis, which is of three types: pinocytosis, phagocytosis, receptor mediated endocytosis. So this also has been released as a separate video. You can watch this video on active transport. So the next one is pumps, which include sodium, potassium, ATPase, and calcium pump. This has already been covered in active transport video. The last part is the transcytosis and ABC family, which will be covered in this video. Now coming to ABC family of transporters. So the transporters include ABC A1. Now this A1 is responsible for transportation of HDL. Now HDL is transported from the peripheral tissues back to liver for its excretion. When this is defective, it results in accumulation of the cholesterol in the peripheral tissues and also peripheral tissue. So there is decreased HDL, and this increases the risk of coronary artery disease among the affected children. This has been noticed in an island called Tangier. So hence this disease also known as Tangier's disease. So the next group of ABC is the ABCB4 transporter, which acts as glycoprotein on the cell surface. Now this has been implicated in the development of multi-drug resistance. Now this glycoprotein that is present on the cancer cells, this glycoprotein pumps out the chemotherapeutic drug that has been given to the patient. So the drug is no longer effective against the cancer cells, and this is how it contributes to multi-drug resistance in the cancer chemotherapy. So the next transporter is ABC2, which is also a glycoprotein on the cell surface, especially in the hepatocytes. Normally, after hemolysis, heme gets converted to bilirubin, biliverdin, and this bilirubin is taken to liver where it is conjugated by glucuronic acid. Now, this conjugated bilirubin is released through common bile duct. It enters into the intestine where it gets converted to urobilinogen, stercobilinogen. Now, this conjugated excretion of conjugated bilirubin is defective in Dubin-Johnson syndrome because of the defective glycoprotein on the hepatocytes. So this results in accumulation of the conjugated bilirubin in the liver, manifesting as black liver jaundice among the affected individuals. The next transporter is ATP7A. This is involved in transportation of copper, and the disorder associated with this transporter is Menkes kinky hair syndrome. Here there is a defective absorption of the copper from the intestinal epithelial cell and its transportation to different tissues or organs, resulting in severe copper deficiency, manifesting as kinky and sparse hair among these children, and also neurological manifestation. And usually the child will not survive more than the first decade of life. Second, the next transporter is ATP7B. This is also associated with transportation of copper, and the disorder associated is Wilson's disease. Now, this is characterized by deficiency of ceruloplasmin, which is acute phase protein, and it is also a transport protein for copper. So what happens because of this defect? Copper gets accumulated in the liver, eyes, and basal ganglia. So the next one is CFTR. The main function of CFTR transporter is transportation of chloride. So when this gets mutated, it results in a disease called cystic fibrosis, characterized by thick, sticky, viscous mucus which builds up in the lungs, pancreas, and other organs. When lungs are affected, it results in difficulty in breathing, and when pancreas, exocrine part of the pancreas is affected, it results in frequent infection and pancreatitis, and when GIT is affected, results in severe digestive and nutritional issues. So this was all about ABC family of transporters, their function, and the disorder. Coming to the last part, transcytosis. Now, transcytosis mainly is involved for transportation of macromolecules like immunoglobulin A, transferrin, and insulin. Now, the mechanism behind transcytosis is that first, the macromolecule is taken into the cell interior by endocytosis, then it is packed into the vesicle, and then it is released from the cell by exocytosis mechanism. So this transcytosis mainly operates in intestinal epithelial cell for the absorption of biomolecules from the intestinal lumen into the circulation, and this transcytosis also operates in blood-brain barrier. So this was all about transport mechanisms. So please do watch the other videos on passive transport, active transport. So thank you.